Christine Newsom, and I would just like to say thank you for the opportunity for y'all listening to me. I am a graduate of Bowie High School. Oh my God, when did I graduate? In 2015. Yeah, that's a long time ago, I guess now. But I'm just really excited to share a little bit of my journey that I am now in dental school. This is my third year. I started during the COVID year 2020, so it was a little bit different from now. So I'll be talking a little bit about that and just how I got to where I am now, third year. Okay, hello. I am student Dr. Christina Newsom. Yes, this is me right here on the side. My color of scrubs for my year is actually blue. A little bit about me. I'm a Nigerian American that was born in Arlington, Texas. I lived in Grand Prairie, but I just went to Arlington school districts. I'm the last of 4 children born to my parents, and so I do enjoy those perks. In my free time that I don't have a lot of, I like to craft, hang with my friends, watch animes, drama, and just be active. I chose the path in dental healthcare just to be able to help create a sense of optimism for people and confidence for individuals that are worried about, their oral appearance. But also now that I'm in school a little bit more, I learned that there's a very great need to teach people about their oral health and their importance and how it affects the whole body. Okay, so while I am a perpetual student, all of the stuff that I like to do here and things that I've just been in school. So I'm sorry I cut so many people off in here, but this was my white coat ceremony. We didn't have it until like our third year because of COVID. This is me, bright and very excited on my first day of dental school ever in 2020. Me when I got my loops, and this is just magnification that dentists use to let us see better. My first class 1, me hanging out with SNDA as a first year, that I'm now the president of that organization. They're my third year, so Student National Dentist Association. That's an organization that seeks to uplift and encourage and advance the enrichment of Black and other minority dental students. More fun pictures. I was able to go to Florida this past June, for the national conference for SNDA. My dentures, practicing root canals, some pre-clinic times, and my parents during my white coat ceremony. And this was actually taken yesterday at our student intercouncil kind of fun thing that they like to do there that just welcomes students to school. And yeah, this was the first time they had it in person since 2019, so lots of good fun stuff. So while I am a perpetual student, I also like to travel and do everything I can do to avoid studying. You can't get through dental school without studying, so heed those words. But this is just a little bit of things that I did just kind of throughout my 2020 through 2022. Actually, this is like a friend picture from high school. We still occasionally meet. Went to a concert. This Burna Boy. Went to Cancun with some friends. I was in the UK here for a cousin's wedding. This was a Galentine social that one of my friends puts on. California a couple times. I went to Disney World whenever we were in Florida this past June, so that was pretty fun. I snowboarded. I stopped the whole ride on that. Friends, family, more concerts, and this is South Korea here. A little more on that later. But here's how I got to where I am. So, as you know, I went to Bowie High School as my high school. For college, I went to Texas A&M in Corpus Christi. Was a graduate in 2019. There, I held a couple of jobs there. My first year, I was an athletics operations member, and I did everything from collecting tickets to recording basketball games. This guy is a really popular guy in Corpus Christi because he always goes to games. From managing a lot of just general operation stuff. But another thing I was a supplemental instructor, aka just a tutor for a biology class for about 3 years after I took the class and passed it successfully. The most one of the most notable things I could say I was able to do was be an orthodontic laboratory technician. So I didn't do the traditional route to get into dental school where you apply your 3rd year in college. I applied my 4th year because I was still kind of wanting to boost up my application a little bit more. And so that gap year that I had, which was also 2020 kind of COVID year, I worked, or a little bit 2019 into 2020, I worked at a laboratory so I can learn a little bit of the ropes, boost up some hand skills, because they say hand skills are always very highly needed in dental school, because we're going to be obviously working with our hands to do dentistry and more. So that was pretty helpful on my application there too. Extracurriculars, I didn't feel like I did a lot, but looking at this, and I didn't even pull some of the stuff from my resume, CV, that you just need to show that you're involved in variety of things. It's not only like academic, but it's also volunteering, and just volunteering/community service, and also having some experience in observing the field that you're potentially interested in going to. So as far as extracurriculars, I was a part of the Alpha Epsilon Delta, and then I became a national member my junior year, which is just kind of more about GPA than anything. And that one is just a nationally recognized pre-health society that we have in the United States. And then at those meetings, you'll have various people of different professions come and talk about their why they like what profession they're in, how you can get into that, and et cetera, et cetera. It wasn't until maybe my 2nd year that I joined the pre-dental society, because I thought about going into the dental tract, and then I was a member, treasurer, and then I eventually became president of that organization, just to help build camaraderie and learn and let students know that, hey, dental is an option that most oftentimes people don't think about, or they'll ask, why do you want to be in somebody's mouth? And it's an option. You kind of have to get past that and just delve deep into why you want to do that. Volunteering, also very important. It's better to have like a committed monthly volunteering that you want to do, but any amount of volunteering and what you gain from the volunteering experience is going to be the most important to when you write your essays and stuff for getting into dental school. And if need be, definitely not text me, email me, or follow me on any of my social accounts, what you'll see at the end of this PowerPoint presentation, for more questions on how to do the application, start studying for tests and things like that. Also, like I said, shadowing, I would say a minimum of 50 hours, so you can actually get a real feel of if you're interested in whatever healthcare field. I shadowed a chiropractor, and I was like, cool. But then when I shadowed a dentist, I was also like, cool. But it didn't really click a whole lot until I was able to go into some summer programs. I did Summer Health Professions Education Program. So it's another organization geared towards helping minority students interested in the healthcare field kind of test the waters, get their foot into the door of learning about what it takes to become a healthcare student. And you get so much enrichment during those kind of programs. This is a picture, because I was actually in Nebraska. There's sites all around the United States for medicine, nursing, dentistry, public health, PA. I'm not sure if I said nursing already, but all of those sites have a variety of programs there that you can participate in during the summer. And I was a part of their inaugural program whenever they opened it to more professions instead of just having medicine and dentistry. So I'm sure they've grown a lot since then. So definitely apply. I really wanted to study abroad. I don't know how I was going to get there in undergrad, but I did. This top picture is a picture of our graduation ceremony. We looked so official with our little soft coats and soft hats, but all I did was do 2 courses. But studying abroad is a really good opportunity, and it's a good thing to put on your applications as well, because it can show that you've had experiences outside of the United States, because how the United States is a very diverse melting pot of cultures here. It's always very good to know that you were able to put yourself outside of your comfort zone to learn how to interact and react to situations abroad. SPEP, I don't have any pictures of that one. There might be in the previous slides potentially, but that was another a collegiate program that I did actually after graduating undergrad, to help prepare me for writing my essays for getting into dental school, and also taking the dental admissions test, which is, not gonna lie, it's a little bit expensive for the prep material and taking the test, but if you can find some organizations and or talk to people, participate in giveaways for study materials, it'll be definitely worth it. As far as barriers, I didn't have a mentor at the time to explain how I was going to get into the path of healthcare. I'm first gen, second generation. I can't remember which one we are. My parents came over from Nigeria and I was born here. And so they knew a little bit about, healthcare system, but not enough to say this is step A, B, and C that you need to do to get in. So I learned a lot of that through my student organizations at school, my health professions office in undergrad, and a lot literally through my summer programs too, because if you don't really have a mentor, it's kind of hard to figure out where you want to start. So congrats on y'all coming to this P-Tech and listening to this, because this is one step in the door. Because if you didn't know anything, hopefully after the end of this presentation, you'll know a little bit more on how and where and what steps you can take to start. Okay, I think I'm interested in healthcare. Maybe I should reach out to my dentist. Maybe I should reach out to my physician. If you have any neighbors, or even ask your counselors and teachers about, hey, they might have, a dentist or another professional that would be willing to take you in as a student to tell you all about their career and their life as insert health profession, Another barrier was considering how I would get all the requirements for getting into school. It wasn't too difficult for me for that, but I still considered it a little barrier because I was fresh and I didn't know anybody. And so I had to take the courage and pick up my phone and call dental offices and say, hi, I'm a student at this school and I was looking to see if I can get some shadowing experience here and yada yada. Most of the time they're all pretty nice, but sometimes you won't get an email back or a call back, and so you just have to take it in stride and keep going forward, and call other offices, because one office will let you come and shadow, and you have to pick a time to come, and definitely write about your experiences, because you're going to need to have some kind of summary of your volunteer, your shadowing, your organizations, your summer programs, just so you can recall and think back on how it helped you into the field that you're very interested in pursuing. Deciding what path to go down, it wasn't until my third year of undergrad that I was like, okay, dentistry. It was kind of, I don't want to say it was a spur of the moment decision, but definitely my summer in Nebraska opened my eyes to a lot of ways that I could help in public health dentistry, which is one area that I'm very interested into. But another story that I can get into later is how when I was in 8th grade, my friend's sister's tooth fell out got knocked out during a basketball game, and I was expecting to see her without a tooth, but the next time I saw her, she actually had a tooth, and what I learned with that was an interim, or just like an interim denture that she had, that she could replace that part of the tooth until she could do something else with it later. And I thought that was so cool that, teeth are things that never grow back, so you really have to take care of them. And she was really sad when it happened, but when she was able to have that interim or that temporary tooth there, it's like nothing ever happened. And so that was one reason why I was like, okay, yeah, if I can really help with building people's confidence and optimism in, their dental health and just being able to face the world with a smile, I would love to do that. The last barrier I would talk about is something that I still go through sometimes these days, whenever sometimes are hard, but imposter syndrome. It's one of those things where you feel like you're not supposed to be in this environment, or everything is all set against you, but you're meant to be there. You're meant to be there. Even if it's really, really difficult, reach out to your classmates, professors, teachers, or anybody you find a mentor that could help you get out of your funk, because you're meant to be there. We don't get put in our battles if you don't have the capabilities to overcome them. So you're meant to be there. Cool. Next is attributes for being a dentist. Learning how to communicate, learning how important communication is, and how to be a good communicator, because in dentistry we're learning all of this science, jargon, science, but then when we're talking to a patient, they're not necessarily going to always understand the science jargon. So you have to put it in a way that they'll be able to understand and trust you about whatever diagnosis and plans you have for them to get them to where they want to be. So that's really important. Being a leader in your community and helping advocate for oral health, so important, because your mouth is connected to the rest of your body. Why wouldn't it be very connected to your overall health? So that's good. You can make a lot of money with dentistry, but that shouldn't be the only thing you're looking into for pursuing a healthcare career in dentistry. But if you don't have loads and stacks of money sitting somewhere, there's also a lot of debt that you have to take out for going into dentistry, to which I have a lot of debt, but it's fine. You will make it back as long as you play your cards right, go to a lot of financial seminars, which is what I'm doing, learn how to make smart financial investments and build your wealth instead of your money. You will be just fine, and you'll be able to pay it off. A lot of older dentists that I know, they're like, don't worry about the loans, you'll be fine, which stresses me out. But hey, those people that have been there, done that, they're like, okay, maybe I shouldn't stress so much about that. There's a lot of different specialty routes you can apply for, or you can just stay a general dentist. Kind of like how medicine is. You can be a physician, family care, pediatrician, you can go into surgery, eyes, ears, throat. Same thing with dentistry. Maybe not the same categories, but you can be like a periodontist, which deals with gums, a pediatric dentist deals with children, and then the baby teeth, and then going into adult teeth. What else do we have? We have radiology, we have oral surgery, internal medicine. The list can keep going. You can have prosthodontics, which is all the removable, like dentures or implants. I'm forgetting a lot of them. Endodontist, which is root canals. There's a lot more, but you can specialize, or you can just be a general dentist. There's no problem with either of them. And then another one is the patient-provider relationship, and it's going to be full of gratitude and confidence boosting, because it feels good whenever all of your book work is finally being able to be translating over to the clinic side. I did one of my first fillings, and my patient was so appreciative of being able to get the filling done that she's been needing to get done for the past, 3-4 years. And I was like, oh my gosh, it's actually coming through. So it's really nice. Pro tip, being coachable is a trait that admission committees are always looking for. Admissions committees, but generally anything you're applying for, because they want to see how well you can adapt to situations in a timely manner, and also learn from your environment and those around you. This picture is a few years old, when I was at a volunteering event called Texas Missions of Mercy, which is where we provide free dental care to people who are able to show up at the wee crack of dawn and stand in line, and then they can get their dental care that they need. Yeah. Click. Okay, so for some, did you know, I'm sharing on a thing here. Did you know snacking 3 or more times a day can put you at serious risk of developing caries, so it's a cavity in your tooth. So our mouth is, as much as you brush your teeth, it's a pretty dirty environment, because there's a lot of bacteria there. And bacteria are able to thrive in acidic situations. So what happens is, whenever you're eating and drinking, the bacteria is already there. Whenever you're eating and drinking food and starchy, carbohydrate things, you're going to get some acid produced. And acid on your healthy tooth is going to be bad and cause decay. And so the more times you put your mouth into an acidic environment, the more chances of decay and possibility cavities are going to be able to form. So brushing the 2 times a day for 2 minutes at least is some serious science behind that. Also with flossing at least once a day. And another thing that's sometimes often not known, like a lot of my healthcare colleagues, they always ask, they're like, how long is dental school? And I say, it's just like medicine. We are in school for 4 years after undergraduate, so like after college, and then you can start practicing immediately after you pass your licensing exams and like practical exams. But unlike medical counterparts, you also have to go through medical, you have to go through internships, fellowships, post all of that stuff to kind of start getting essentially the real bread that you really want. But after 4 years for dentistry, if you get a job and you pass your stuff, you can start working and sadly paying back those loans, but also, getting a little income for yourself. And then also one thing I would say is less than 15% of dentists come from underrepresented backgrounds. And underrepresented backgrounds, that just means like minority black backgrounds. So black and indigenous and other people of color. It's changing, but it's at a slow rate. So that's why I'm here, to help and encourage more other minorities to get into dentistry. Cool. Next slide. So expectations versus reality, dental school edition. I expected to be overwhelmed with dental school learning materials because this is a known fact about professional schools. I expected to not know a lot because I have no background in dentistry. Nobody that I know immediately is in dentistry. So I couldn't really ask more people about what do I need to study and things like that until maybe college, whenever I was able to do those summer programs. So even though I knew this, I expected to be able to learn a lot from my faculty and classmates from what I learned about the school that I go to now, UT Health School of Dentistry in Houston, during my interview and about the dental school environment. And it was really nice and warm and friendly. So I mean, it's still like that. So it's what I expected. And this little picture of 2020 me when I first got my blue scrubs that I had to wear for the next 4 years. But in reality, I still was overwhelmed, a lot more than I anticipated. And it was really shocking because it was the first time that I was literally not doing well in school, in a school setting. So it took me a while to get used to facing these challenges. Because, like in your pre-collegiate levels, they're like, oh, there's gifted and talented. Oh, the student is so good, so smart. We don't have to worry about her. She already knows how to study. When in fact, I did not know how to study. It's still taking me a little bit to learn how to study different kinds of materials. So I really encourage people to sit down and take the time to figure out how they study and how they learn the best, whether it be by reading, watching videos, doing things with your hands, listening to it. It's really important to figure out how you study best because you can get really behind in stuff during your professional schools and even college too, because it's a different pace that they're going and they're expecting you to keep up with. But I just knew I would be able to overcome these challenges, so you get one challenge and you're able to overcome and then another one comes back. So it does take a little bit to get used to, but it did take me a little bit longer, but I knew the end will come. Like I said, you're not put in any challenges that you can't overcome. But I did have a lot of support from my dean of students and friends uplifting me through the setbacks, but it helped me to know that, okay, I know that I'm going to have some struggles in this, even though as much as I want to study and learn, you kind of have to do what you have to do to get through taking the course materials and just passing while learning how to understand the material in a timely manner. Next slide. The number one thing students should remember is that no question is a dumb question. Everybody's always like, oh, I don't want to ask a question. My first year, I was always asking questions. I even, at the end of one of my classes or semesters, I got a reward for asking the most questions. And I was like, oh gosh. But the chances are really high that at least 3 other people have the same or similar question. So don't be afraid to ask during class with all your classmates around, at the end, so you can go walk up to the teacher, but when they're packing up, to ask that question, or even by email. If you really don't want to ask in front of people, everybody should be checking their email at least once a day. So ask them by email, because if you're stuck, you might use this as an excuse to not continue doing. You're like, oh, I don't understand that concept, so let me go play video games or something. So ask that question. One quote that I really like is that from afar, we admire talent. Up close, what counts most is character. You can impress people with your skills, but you earn their trust by standing for something greater than yourself. There is no higher achievement than treating others kindly and living with integrity. Adam Grant. I don't know who that man is, but this was one of the quotes that one of our faculty or clinical director sent us in an email one year. And I was like, this really stands out. And I feel like it stands for my personality of always wanting to help where I can and offering opinions sometimes when they're not warranted. But since I have experience in that area, I always want to try to help people do their best in whatever they're achieving or wanting to achieve. So I really like this quote. As a bonus quote, comparison is the thief of joy. Say it with me. Comparison is the thief of joy. I used to do it a lot when I was comparing myself to other classmates and people that are my same age. But when you're doing that, you're really belittling all of the little things, even the big things that you have done yourself to be at the level where you're at. Not everybody is going to become a dentist. Not everybody is going to become a physician. Not everybody is going to be anything in healthcare. But you can't, I forget the word, shrink whatever you've done, because you've done a lot to get to where you are. And when you're comparing yourself to others, you're thinking about, oh, I could have done this, I could have done that to be at this level, when your comparison should be to your past self. What have I done better, or what can I do better to, be the best version of myself that I can be? So that's one thing you can really, really think about. Like the first time I heard this, I was like, oh, I almost shed a tear, or I probably did shed a tear about this, because it came at a really important time when I was so stressed and I wasn't getting where I needed to get. And I was looking at all my other classmates and just people in life that were, oh, they're here, I'm only here, oh, I'm still in school, yada, yada. But just, it's your own race. And so everyone is on different levels, and that's okay. So some have to work a little harder than others, but reflecting on your own progress and yours only is only where you can find your growth. So just always keep that in mind. And remember, these are little comic things that I drew. Remember, brush 2 times a day for at least 2 minutes. Flossing at least 1 time a day. Eat and snack smart, and repeat for a healthy mouth. And help, influence diversity in our schools. And thank you. If any of you have any questions, feel free to contact me at talktoteen1@gmail.com. And this is also my Instagram handle if you're really, really interested. And I really thank y'all so much for taking the time to listen to this recording here that I have. I recorded it and I need to go to school in a little bit, but for sure, if y'all really have any questions, definitely look at that previous slide and contact me, reach out. Best of luck to y'all. Bye.